Drew Shockley, and I'm one of the founders of Move Health. Thank you for coming and joining us today. If you are thinking that you're signing in to a session called What Financial Advisors Need to Know About the ACA Marketplace Open Enrollment, you are in the right place. And we appreciate you all taking some time to join us here at Move Health for our Open Enrollment Summit. We've got a jam-packed agenda. And, those of you that maybe you did or did not know this, actually, this is CE credit eligible. So if you are out there and you did not know that, go through the process. We'll send you some links, some information so that you can make sure you get your CE credit for attending today's session. But I'm super excited to be with you all. I'm coming to you from Evansville, Indiana, from the Move Health office. I've got some lights here and a nice audio setup, and hopefully you all can hear me quite well and see me well, and we can dive into today's content. So I'm super pumped and excited to be with you. Thank you, Josie. I want to introduce somebody to you. Josie Living Good is in the chat. Everybody say hello, Josie, in the chat if you want to. She's putting some incredible information out here about what I just said a moment ago. So if you are looking for information about the CE credit, make sure after the webinar, we will send you information. You can go to the CFP registration, put that information in so that you can get the CE credit. And with that, let's see. Let me check our totals here. Yes, we still have people joining. If you're not familiar with Zoom, just go ahead and familiarize yourself with the tools. You should have a chat function. It should pull up a separate box. Thank you, Beth. Beth says, hi, Josie. Josie is amazing, by the way. She runs all of our marketing here at Move Health. So anything that you see out there that we put out there that looks good, all the content, videos, all the stuff, Josie is responsible for that. So Josie, thank you. You're amazing. But if you are, for not familiar with Zoom, go ahead and make sure you got your chat box up so you can see, the dialogue that's going on. And then there is a specific Q&A that you can use. So we invite you to do that. We'll be watching the Q&A as well. Josie will be doing that, and she'll be managing that. I'll have it up as well, and we may answer some of those questions live. We may answer them, at the end, and we'll try to just stay engaged with you all the entire time. But with that, we will go ahead and jump in, dive in, and we will learn about what financial advisors need to know about the ACA Marketplace Open Enrollment. A lot of content in this stuff. I am super pumped. So if you're seeing me here, I do have a family. I'm a normal person. I was born in East Tennessee, and I went to college in Indiana. I've been married to my wife now for almost 20 years, actually 20 years now. And we've got two teenage boys. They're 16, 14. I started my career in health insurance working for Anthem Blue Cross Blue Shield 20 years ago. So my entire adult life, I've been working in health insurance and Medicare. I've been a part of 3 successful startups, with the first one back in 2008. And, I love healthcare. I love Medicare. And I particularly love working with financial advisors. I think that you have such an ability to make an impact on healthcare costs and Medicare costs. And we love partnering with you all. So outside of this, if I'm not hosting a webinar or doing stuff with Move Health, you can find me on a soccer field or pulling our boys behind our family boat or playing golf, like Christine mentioned too. She took it up. I've seen her swing. She's awesome. So Christine, thank you for the opening session. You're amazing. And everybody is here because you want the content. So let's dive in. So in this session, we have 4 learning objectives. Okay. Learning objective number 1, which is what we're going to start with in a second. You're going to be able to accurately recall the dates and timelines of the open enrollment period for ACA Marketplace. This is like bare minimum. If you can't do this when we're done with this session, I'm not doing my job. So number 1, you gotta know the dates. Number 2, we're going to identify some changes that are possible during the ACA Marketplace Open Enrollment period. So we're going to talk about what clients can do, what they need to be doing, and so that you can kind of help guide them as a financial advisor. And then number 3, we're going to understand the financial impact of not reviewing insurance coverage annually. Like, what happens? Like, it's okay. I like my plan. I just want to keep it. Can I just, keep it? The answer is no. So we're going to understand like the risk and the financial impact, particularly going from 2025 to 2026, and what your clients could be facing. So we don't want you to do that. And then lastly, I'm going to help you understand how to identify some planning opportunities. We're going to talk about the One Big Beautiful Bill. We're going to talk about the potential sunsetting of advanced premium tax credits. We're going to talk about all kinds of stuff, and we're going to teach you how to identify some planning opportunities for clients during this period of time. So buckle up. stay with us. We're going to dive into number one. So what's the Affordable Care Act? What is it? What are some timelines? What are some important information? In order to really do this, we kind of have to go back and do a little history on the ACA. So, if you've been around for a while, you know that the healthcare has always been a topic, from the federal government perspective, from a political perspective. The Obama administration passed the Affordable Care Act law on March 23rd, 2010. That's an amazing party trick. If you want to memorize that, if you're hanging out with people, they're like, hey, when is the Affordable Care Act passed? You can say March 23rd, 2010. So it's been around for a long time. And I love this little graph here because it actually is now representative of about 40,000 pages of rules and regulations and guidance. That's a lot. That's like way more than what they stacked on the table, back in the day. So passed in 2010, and it was implemented in waves like 2010, 11, 12, 13, with really the largest one of these waves coming in 2014 with the federal marketplace. And, 15 years later, it's still the law of the land. It's still working. It's still there. And in fact, it's made it through multiple administrations at this point. So we go back to Obama, right? So 2010 to 16, his administration passed the Affordable Care Act, which, was built on Medicaid expansion. So like state low-income programs, healthcare.gov was created. That's where all the insurance companies put their plans on there and people can go and sign up. The advanced premium tax credits were calculated. A bunch of rules were put in place. It required insurance companies to do the 10 essential health benefits. It created the gold, silver, bronze, metal level type stuff. It impacted and influenced really everything. Okay. So way more than we could put on one particular slide, but that's the Obama administration from 2010 to 16. Where the Trump administration came in. Originally, there was obviously a ton of talk about repeal, replace, all this stuff. And the Trump administration actually did a lot of really good things to really improve the Affordable Care Act, but obviously they did not replace it. It's the law of the land still to this day, 15 years. The Trump administration eliminated the individual mandate penalty. I don't know if you were around or paid attention to this back in the day, but originally in 2014, if you did not sign up for an Affordable Care Act compliant plan, the federal government actually penalized you $695 per adult in the household if you didn't sign up for one of the plans. Crazy, right? So the Trump administration actually did away with the individual mandate, or let me say it a different way. They actually reduced the individual mandate penalty from $695 to $0. Okay. So look, it's actually still there. It's still a part of the law. You still have to report on your taxes and all that stuff. It's just that if you don't have an Affordable Care Act compliant plan, the penalty is $0. Interesting stuff. During this time, they also kind of expanded short-term plans and association plans, some good, some not so good stuff there. And they brought, but really the Trump administration brought more carriers into the marketplace. They loosened rules and it really helped profitability, and premium costs stabilized during the Trump administration. The Biden administration, lots of stuff going on in 2020, right? We had COVID, we had all this stuff, but the Biden administration came in and immediately expanded premium tax credits or subsidies through the American Rescue Plan and the Inflation Reduction Act plan. We're going to talk about that. We saw record enrollment. They reversed the Trump's short-term rules. They kind of did away with those. Unfortunately, a lot of like insurance company profits like squeezed, and we saw rates on the rise. Kind of a lot of things going on. And then right now, obviously, we got the Trump administration back in the office. There's early signs of push to scale back subsidies and all this stuff. It's being talked about a lot, and roll back some of the Biden expansions, but there's a lot that's still yet to be determined. So we're going to do that. And I want us to stay kind of engaged here. So I saw Beth did a good job in the chat. I'm actually going to put a pop quiz out there, and I want you to respond in the chat here. So if you got your chat box up, no Googles. Okay. Josie's watching you. No Google. What is the total U.S. population? I don't know. If you get it right, there might be a prize. Oh, wow. Cameron Eddy. I believe it's Eddie. Cameron Eddy, you win the prize. You're first in. 330 million is correct. Amazing. Okay. It's roughly around there. Obviously, there are people being born every day and people dying every day, but there's, the population changes, but it's around 330 million or so. And so like, why does this even matter? Why are we even talking about it? Well, I want to talk about it in context of how people actually access healthcare coverage. Okay. So overall, around 50% of the population actually have healthcare coverage through their job, right? This is probably no surprise. Gold star for Cameron. Great job. This is probably no surprise to you all. Around 50% of people have healthcare coverage through their job, right? So they're working, typically there are a bunch of rules that the Affordable Care Act put in place around employer benefits. If you have 50 or more full-time employees, you're required by the federal government to offer insurance. Okay. If you're less than 50 full-time employees, you're not required to do anything. You actually don't have to offer insurance. A lot of companies are doing that. We do work with companies in that situation that, trying to do something. We help them leverage things like ICRA and the individual market and stuff like that. Kids can stay on your plan until they're 26, and people that are in this, they could still be 65 and older and still work. Okay. But right now we got about 50% of the population covered through their job, just part of what we do in America. We have over 14% of the population that actually is using Medicare or eligible for Medicare. You all are smart. You're on this thing. If you're on here, you're a financial advisor, most likely, or on a team of financial advisor. Who's eligible for Medicare. Those 65 and above, maybe disabled. We help people here through Medicare supplements, Medicare Advantage plans, prescription plans, and we've got a lot of people entering into to this market, right? So, 4 million new consumers every single year. So we're going to show you some statistics in the Medicare section a little bit later. Medicaid. What's the difference in Medicare and Medicaid? Well, Medicare is federal and Medicaid are state-based programs. Medicaid is a state-based program for low-income adults and children. If you're a financial advisor, you're not typically working with Medicaid, but this is for low-income adults and children. It's the state-based programs. They do use federal funds and things like that. And we have to be aware of the rules when it comes to Medicaid because of the way that advanced premium tax credits work and all of that. So how many people purchase their own insurance? Well, around 6% or so actually purchase their own insurance. So this is the individual market. So this is people outside of a job, right? So this is Affordable Care Act, short-term sharing programs, faith-based sharing programs, ancillary products, stuff like that. This is only like, if you put a room of 100 people, representative America, it's only like 6 people. So, those numbers have kind of fluctuated. Sometimes it's 6, 7, in that neighborhood, but this is the individual market. And then lastly, we still have a number of people that are uninsured. So, sometimes it's due to people just don't know. They just, maybe they're in between jobs, stuff like that. So we still have a number of people that are uninsured. We haven't solved that yet. But this is kind of a representation of how people are enrolled in healthcare coverage here in the U.S. So I want to zoom in on the individual market. Okay. This is a view from the Kaiser Family Foundation. This is our source. And this is the growth of the Affordable Care Act marketplace or the individual market over the past 10 years. Originally, from 2014, we saw, about 8 million people kind of went in that first year. We were up late. Our team was up late enrolling people in plans that very first year. It was tough. We've really watched a significant amount of growth in the individual market. And that's due to, a number of things. If you look at the market now and you kind of take a deep dive, there's around 25 million people in the individual market. Okay. So there's quite a few people in the individual market, and around 23 million of those have an Affordable Care Act compliant plan through federal or state-based marketplaces. Okay. So whether it's healthcare.gov or a state-based marketplace, we're going to show you a little bit later. Roughly 1.7 million or so, or a kind of a small percentage of people have faith-based sharing programs. And then the balance have short-term or limited medical plans. So kind of under 1 million. So if you look at the individual market as a whole, the vast majority of people are enrolled in ACA compliant plans. Okay. There's a lot of talk, and we get questions all the time about, can I just buy a private plan or can I do my own thing? Well, the Affordable Care Act is the law of the land. So you can buy on Marketplace, off Marketplace. But the reality is there isn't really such a thing as like private plans. We'll help people understand that whenever we go through the process here at Move. But this is a look at the individual market and how it works. So just to really kind of speak about the marketplaces or how they work, the vast majority of states are federal marketplace. Okay, so anything in the light blue is a federal marketplace state. So like I'm in Indiana. Indiana uses the federal marketplace. The state just beside us is Illinois. You can see that's a dark color. It's a dark blue, and it says state-based federal platform. Okay, so they have a state-based marketplace, but they have chosen to use the federal platform for enrollment. Okay, so it's really easy for us to do business there. The ones that are in the kind of the middle navy blue, okay, these are states that have state-based marketplaces. So the big one that we all kind of familiar with is California, Covered California. If you want to buy an individual plan in that state, you have to go through the Covered California website. Okay, it's just what you have to do. We're going to talk more about, state-based marketplace and how that worked, but like Nevada, Washington, Colorado, Kentucky, Pennsylvania, New York, like these are all very, states where a lot of people live, but these are state-based marketplaces. And so it's just, very, very different from how you do business versus the balance of the other states that work off the federal platform. When it comes to enrolling in ACA Marketplace, there are key dates. Christine was kind of mentioning some of these earlier, but really the key date for people who want coverage to start on January 1st of every year is November 1st through December 15th. It's a 6-week period. It's kind of wild. You got Thanksgiving in there, and you got, the Black Friday day, all the shopping and all this stuff, and the holidays are coming up, and then all of, everybody's trying to, enroll in health insurance for the next year. Pretty wild for us. If you missed that, you can enroll between December 16th and January 15th for a February 1 start date. But the vast majority of people make plan decisions between November 1 and December the 15th. Of course, there are special enrollment periods when you can do things outside of normal times, right? Typically, these are 60 days from life events. So if you have a client that retires, they don't have to wait until November, December to get a plan. Okay, so they can do that when they lose coverage from an employer. If their COBRA is ending, they can enroll in an Affordable Care Act compliant plan. If they go through marriage or divorce, they move to a new area or a new state, things like natural disasters or marketplace errors, stuff like that. People can enroll in Affordable Care Act marketplace plans, during those times. It's not just the standard enrollment period. You have special enrollment periods throughout the year when people can do it. So, it's complex. The vast majority of people that are doing things, are using an agent or a broker. So these rules require agents and brokers. It requires us to go through annual certification with federal marketplace, with the federal government, and with all of the state-based marketplaces. So a lot of like agents have kind of left the industry because it's a little harder. It's not as easy as it used to be. In fact, some states even require additional licensing that we have to use. So like the state of Arkansas, for instance, has a separate license. While the 2025 percentage is not yet available, a 2024 Kaiser Family Foundation analysis it has indicated that approximately 80% or 78% of active enrollments were assisted by an agent or a broker. So, agents and brokers play a really, really important and vital role in this particular market because it's complex, it's hard, and there's a lot of things going on. So that's learning objective number 1. I hope you learned some ACA basics, what it is, key dates, things like that. We're going to move on to number 2. Number 2 is, you as a financial advisor, how can we guide clients through the ACA Marketplace Open Enrollment? Like what can people do? How do we optimize tax credits? And what are some other helpful tips? So we're going to dive into this. This one's going to be fun. I like this particular section. Okay. So, Christine mentioned it earlier. Here's things that people can do. They can shop and compare plans annually. They can update their household income and info. This is ultra important. People really, really have to do that. They can consider some alternate options, right? If they, if they're not happy with what they have, they can look at, faith-based sharing programs or maybe some other, alternative plans. And then, really they got to plan for changes coming up in a year, right? So sometimes people have kids that are turning 26, or sometimes a spouse is turning 65 and moving on to Medicare. Maybe they're moving to a new state, they're retiring. All of these things are very, very important considerations. And really, where financial advisors can step in and help, you really, in my opinion, shouldn't be looking at, networks and formulary lists and doing that. You should leave that kind of to an expert, because it's very complex and there's a lot of things that there's a lot at stake. And so really where we think financial advisors can step in is financial advisors have a significant ability to control healthcare premiums through effective income management. This is the number one way that you can help people control healthcare costs in retirement. So how do you do that? Well, Roth, use a Roth for tax-free withdrawals, right? Draw down non-taxable assets first. Maybe manage capital gains, like watch how that stuff goes. Delay Social Security. A lot of people, Social Security is included, in income when it comes to leveraging premium tax credits. Maybe you can help reduce taxable income through charitable giving. Maybe, you can create some cash reserves in a previous year. This is one of our favorite things, to do around, tax planning and modified adjusted gross income. A client wants to retire in 26. Well, what do we need to do in 25 to reduce the modified adjusted gross income? Well, let's do some things in 25. Let's do a backdoor Roth. Let's do a Roth conversion. Let's do this. Let's do that. Let's get some cash out now, take the tax hit, and then we'll we'll live off those reserves in 2026. So lots of things that can be done in this particular window. And all of this is so that you can avoid, a surprise at tax time. We don't want that for clients. And really the key to this is understanding the federal poverty level, understanding eligibility, and who can actually get premium tax credits. Okay. So I'm going to answer that. Premium tax credits are not for everybody. They are for people that do not have coverage through an employer, Medicare, or Medicaid. It's got to tell you, it's often that people say, well, I just didn't do my employer plan. I'm going to go on a plan with tax credits. You're not supposed to be doing that, okay? Tax credits are for people that don't have coverage through an employer, Medicare, or Medicaid. What do? They immediately reduce the cost of the plan, right? They're paid directly from the government, and they're based on your modified adjusted gross income for the current or future year. It doesn't matter, what it was in previous years. It's based on the current year. Originally, premium tax credits started at 400% of the FPL and below, okay? Originally, but that's not the way that they've worked for the past 4 years, really. They were expanded through the American Rescue Plan Act in 21, and this is through the end of this year. This is where we live right now. This is how tax credits work today, okay? So here's a chart. This is 2025 federal poverty level chart. There's a lot of numbers on this. I just want to draw your attention to the left side, number of persons in the household. And I want to draw your attention to the right side over here, the 400% of the FPL. Didn't mean to put a red line on there. 400% of the FPL. This is a number that's going to be very, very important to you if you have a husband and wife, and if we see, a change in the way that, tax credits work in 2026. But today, that's not how they work. Today, virtually most clients actually qualify for an advanced premium tax credit, even if they're above the 400% of the FPL. You can see as you move down the income chart or the federal poverty level chart, the cost of healthcare, the more tax credits increase and the cost of your health plan is reduced. This is all predicated on this factor called the 8.5%, which is called the affordability factor. Okay. This has been a hallmark of the Affordable Care Act since the very beginning, since 2010. It says that no household should pay more than a certain percentage of their income for healthcare coverage. But this 8.5% number is for the silver benchmark plan. Okay. So if I saw someone at the grocery store and they said, hey, how much is my health insurance going to be when I retire, when I move in, away from health insurance and I move into retirement through my employer and I move into retirement, how much is it going to be? Well, I can pretty much ask them, one question, and I can determine roughly what they're going to pay. And it's all predicated on this 8.5% affordability factor. But I want to be clear, this is for the silver benchmark plan. Okay. So if I go back to the income chart over here, the lower you go in modified adjusted gross income, the more tax credit you get. And then that affordability factor actually goes down. So let's look at an example here. A household of two, with a, modified adjusted gross income that's in the 300% range, their actual premium output, or what they would pay, would be closer to 6%. And just another example, if you put a household of two, down around the $50,000 mark, then their healthcare premium tax credits are going to go up. They're going to get something called cost share reductions. And then we're going to see something in the 2% range. They're not going to pay very much for health insurance coverage. Okay. This happens all the time. We see this all the time, and it has nothing to do with net worth. It has everything to do with modified adjusted gross income. So in today's world, this 8.5% number is a number that you need to be aware of, and we need to be managing modified adjusted gross income down. So what can advisors do? Well, you can anticipate life changes, right? Aside from managing income, you can anticipate life changes. You can provide some basic education on how marketplace plans work. You can clarify some misunderstandings of people saying, well, I won't qualify. I'm sure that I won't, I have a high income. I'm never going to get tax credits. I'll tell you right now, we have clients, multi-millionaire clients all over the country right now with incomes well into the $200,000 MAGI range, modified adjusted gross income range, that are utilizing premium tax credits. It's just a fact. That may not be the case in 26, still to be determined. But we have a number of high income, high net worth households that are using tax credits to buy an Affordable Care Act compliant plan. We recommend, obviously, to align healthcare coverage and premium tax credits with financial plans, right? This is like the whole reason that Move Health exists. We want to partner with financial advisors to help you align coverage with financial plans. And really, you don't have to be an expert, but you just need to know enough to really make an impact with the clients that you're working with. Okay. So just be a guide, just help people kind of navigate some things. Again, you don't have to know everything, but you just need to really be a guide. And so that kind of leads us into our third point, which, there's a cost. There's a lot to lose for somebody that is not doing effective tax planning. There's some pretty large financial impacts for those that are not making the most of the Affordable Care Act open enrollment period. And so I'm going to take some time. We're going to go through this section. We're going to actually look at a case study. We're going to talk about HSAs and some other stuff. And so, really, as I said, there's a lot to lose if clients aren't doing it. Number one, lost subsidies, right? So, failure to plan, could result. We have some clients that are utilizing $25,000 a year in advanced premium tax credits. Pretty massive. Those are real. That's a real loss. If that happens. There's also a lot to lose if you get their income wrong, right? So if clients underestimate or they have additional income they weren't planning for, say, hey, I need some money. I'm going to go on a cruise. Can you send me $10,000, right? That could send them over. If you send them taxable $10,000, that could send them over tax credit eligibility and have the income they weren't planning for. And it could be a surprise at tax time. Okay. So you have to understand this. You have to know this. And try to make markers so that that clients don't do this, or you don't allow them to. I mentioned it earlier, but some cases, if big clients are managing their income down relatively low, they not only get tax credits, but they get cost share reduction. So they get lower deductibles, lower out of pocket stuff like that. And if you get it wrong, there's a lot to lose there. And then the biggest one that I know we all care about, is really retirement plan misalignment. People have worked their entire life. They've saved up a bunch of money. They're coming to you. They're already worried about, retiring and going into, this next phase of life. And the last thing we want them to be, to keep them up at night is healthcare. And so, really, if we're not guiding clients appropriately, or you don't have a strategy that's combining healthcare and income management along with, the retirement plan, it really puts clients at risk to have problems. So we don't want you to do that. And those of you that are here, obviously, you're here to learn, and we won't see that case. So I want to look at a case study. Okay, so this is a lovely case study. I think I think you will see the impact of effective healthcare management and putting a strategy in place. And we're going to go down to Savannah, Georgia. Okay. So this is a 61-year-old couple. Here they are sitting on the couch, with their grandkid, their grandson, reading a book. They want to retire because they want to spend more time with their grandkids, right? So here we are in Savannah, Georgia. The husband had held health insurance through his employer for 35 years. Okay. That's normal, right? We know that 50% of people have healthcare coverage through their employer. And, that's a normal thing. Just a little bit about their profile. They have $2.5 million in investments and a $750,000 primary home. Okay. So this client, theoretically has a net worth of well over $3 million. And what they're used to $200,000 a year in income. Okay. Normal. For those of you that you're using any of the top financial planning platforms, most of the time, the top financial planning platforms will give us an estimate, or give you an estimate of around $30,000. Okay. And if you don't really dive in or do anything extra, you're just going to kind of use that figure, go into the meeting with them and say, hey, we're going to get you retired and everything's going to be good. Healthcare is going to cost you 30 grand. But if you have if you have an understanding of how healthcare works and you're diving into this, let's look and see what their impact can be if you use effective income management. Okay. So same couple, same situation, Savannah, Georgia. They're used to 200,000, and that's what they want in retirement. Okay. So this advisor, super smart. They know what's going on. They've got some non-taxable resources over here. And this advisor says, hey, here's what we're going to do. We're going to use $90,000 in non-taxable income, and I'm going to send you $110,000 in taxable income. That's going to make your modified adjusted gross income $110,000. What does this do? It unlocks $17,760 in advanced premium tax credits for the year. Okay. This is 1 year. This actual premium after these advanced premium tax credits are applied gets them down to $756 a month, right? Pretty massive, right? This advisor, pretty smart. Hey, you need 200,000, but that doesn't mean I have to send you 200,000. We're going to use 90,000 over here in non-taxable. We're going to use 110 in taxable, and we're going to do this XYZ. This is the strategy. The first Social Security, everything's good. Your healthcare costs are going to be $750 a month. Okay, everything sounds great, but what if that financial advisor took it one step further? Same case, Savannah, Georgia, 200,000. The advisor uses 150,000 in non-taxable. Somehow, some way, they did some sort of conversion over here. They knew it was only going to be 3 or 4, years, 61, 62, 63, 64, till they get to Medicare, whatever it is. They did some pre-planning. They put a lump sum over here money, and they're going to live off this non-taxable, and they're going to bring their taxable all the way down to 50,000. Okay, this could potentially be a massive unlock for people in 26 and beyond, because the first scenario, they would not be eligible for tax credits if the rules go back to the original 400%. But this is going to bring their MAGI down to 50,000. How much does this unlock? $25,000 a year in advanced premium tax credit. Again, this is a $3 million net worth client, bringing their modified adjusted gross income down in retirement to 50,000. This is unlocking $25,000. Massive. Actual premium credit after credits are applied, $135 a month. This is not a typo. Josie helped with a lot of slides. She did an amazing job designing some of these slides. This is a real one. We put these numbers in. This is a real scenario. Okay, what does that mean? Effective income management. Can this particular couple in this case study is worth $100,000 over a 4-year period. That's massive. This is an unlock that financial advisors around the country are not taking advantage of. So there's a lot to lose. Don't let your client navigate it alone, right? Effective planning or appropriate planning can be worth $100,000 in retirement. Effectively navigating healthcare is a full-time job. Don't try to do it for your clients. I recommend finding a partner, finding, somebody that can help, because things change every single year. You don't want to be doing that. So, I made it, kind of alluded to it a minute ago. What are we going to do if we lose tax credits? Well, the world we've been living in since 2021 is a world where we have expanded tax credits. This is the slide here. If the income limit or the cliff or the 400%, what we've been living with, over the past, 4 years, if that returns, then literally people who are over this amount will not get tax credits. Okay. If you're a husband and wife in this particular scenario, if you are $1 over $84,600 of modified adjusted gross income, you will not get credits. Therefore, your health insurance actually will be $30,000 a year. Okay. We don't want that to be the case, or at least we don't want that to be the case if we can avoid it. Right. So why does this matter to you? Why does it matter? Well, not everybody that is in the Affordable Care Act actually has an income above 400% of the FPL. If you actually go back in 2021, there was only like 400,000 people that actually had an income above 400% of the FPL. Right now, it's estimated to be about 1.5 million people. So out of the 25 million people that are out there, only 1.5 million people have an income above 400%. I don't have this data or this statistic, but I'm going to assume that the vast majority of them are probably mid to high net worth individuals that are working with a financial advisor. Mid to high net worth individuals have higher incomes generally, and they're working with a financial advisor. So I don't want to say that this is only a problem for, certain people or, only for 10% of the population. I think that it's actually quite a bit higher of a percentage of a problem for people that are working with financial advisors. Okay. So the other problem is nobody really knows about it. Like if you look at this, sure, people have heard about it a little bit, but, most people have heard little or nothing about the implementation or expiration of enhanced subsidies. Okay. The government, they're talking about it, both sides, Republican, Democrats, they're talking about it. They're trying to do things, but reality is that most people don't know that this is coming, and financial advisors should be doing things right now to plan for this, especially if you have some people, again, mid to high net worth that have the ability to do it. You should be doing some things right now. I mentioned them earlier, but Roth conversion, using Roth, draw down some non-taxable assets, manage capital gains, delay Social Security, reduce income through charitable giving, right? Create some cash reserves in a previous tax year. If you've got somebody that's retiring in 26 and we don't know what's going to happen with tax credits, we gotta do some stuff now. Okay. You got to dive in. You got a few months to be able to do it. Create some cash reserves, maintain levels to avoid a surprise at tax time. Okay. And this all is kind of predicated on you as the financial advisor, understanding the FPL and eligibility for premium tax credits. So there's a lot to lose. I want to give you one more tip to make the most of open enrollment. We mentioned earlier, Christine mentioned that we're going to be, going through some things on the, the one big beautiful bill, and we're going to talk a little bit about it, right? There's nothing in there today that talks about enhancing premium tax credits. If they do that, they're going to have to do something outside of this. This already passed, but it did actually do some positive things. Eligibility for health savings accounts have expanded. Now, virtually every bronze level and catastrophic level plan qualify for people to make HSA contributions. Big lift. Telehealth services like telemedicine, when you call a doctor and do it over video, do it over the phone. This now can be covered by high deductible health plans, and it doesn't kick out HSA eligibility. There's some stuff with direct primary care. So, some people utilize a specific network of DPCs, and, HSAs can actually be, it doesn't, in the past, this has prevented someone from participating in an HSA, but that's not the case anymore. So, people that are in, the HSA qualified plans and they want to utilize a DPC, they can actually reimburse, that, up to $150 or $300, a month for a family. What didn't make it into the bill were changes around Medicare enrollees. So they were trying to make, one of the suggested provisions were to change it so Medicare enrollees can still, contribute to HSAs, but that's not the case. If you have somebody on Medicare, they cannot contribute to an HSA. Okay. They also talked about some higher HSA contribution limits based on income. That's not the case. That did not make it into the bill. So, when it comes to this, you got to really stay in tune with this. We got to stay in tune and watch. I mean, you can just Google out there right now, about enhanced, tax credits and sunset of 25 and all that stuff. And really, we're just kind of in a waiting game. I hope some action is taken in the next few weeks. Open enrollment is in November. So we don't really want to wait until that period of time. It doesn't make sense. And we certainly can't wait till 2026 to make this change. It'll create a, bunch of chaos in the market. And I'll just, make a comment real quick before we move on. A lot of insurance companies right now are a little bit concerned about the loss of enhanced premium credits. If you also want to do some research out there, we're looking at potentially much higher premium cost in 2026. In fact, some of the major insurance companies have filed for some pretty massive rate increases. Now, for those that are utilizing premium credits, they don't really see or feel that as much, because the premium tax credits just increase, in conjunction with those premiums, right? So if you're getting a tax credit and the premium goes up, well, it just means that the tax credit goes up, right? So you don't really feel that. But if we have a situation where enhanced premium tax credits go away, and we have a situation where insurance companies, what the premiums they filed for 26 are, markedly higher, we could be in a situation where clients that are not managing their income appropriately could see pretty substantial rate increases in 26. And so we want to try to avoid that if we can at all costs. So what can you do? This is the last learning objective in this session. Okay. Josie tells me we have about 10 minutes left. So we're almost there. Hang with us. I don't know. Hopefully you're getting something to eat, something to drink. If this is your lunchtime, hopefully you're snacking on something. We can't see you. You're not on video. So I hope that you're, learning something as well as, being productive on this particular time. But, what can you listen for? Like, what are some keywords that you can look for in client meetings to help understand some planning opportunities? What about using your CRM? What are some helpful tips that you can do to identify opportunities? Well, I'm going to tell you. Here's some things. Obviously, I'm retiring early. Pretty simple, right? I'm leaving my job, or my COBRA is ending, right? Pretty big deal. I'm turning 65 soon. My spouse is retiring. I just got divorced, remarried, etc. Like these are some triggers, right? These are some words that can really, bring up, hey, we should probably talk about healthcare. We should probably, have a conversation about that. Other things, when you hear people, hey, my premiums are going up, or, we can't afford, this coverage anymore. Or I'm confused. I don't know if I qualify for tax credits or not, or I had a huge tax bill last year. We don't want to do that, right? These are some things you can say, oh crap, they probably, we probably should talk to them about healthcare or do something with healthcare planning. So pretty massive. These are some pain points, and these are common. You hear these all the time. And these are some things that are going to get you, into a deeper conversation, with clients about these things. So, Christine made a mention, about it earlier. So everybody out there probably has a CRM. You have ways to kind of filter and go through things. I would advise you to start looking at clients that are in that 60 to 64 range. People that have enough retirement assets that they can actually, retire early, and they can implement kind of a healthcare strategy leveraging, tax credits. I would advise you to do that. These are people, if you haven't talked to them about it, it's on their mind. I guarantee it. And they have friends that have quit their job and have moved into retirement, and they're jealous, right? They see them going to the park on a Tuesday and they're logging into a meeting or going to the, office or whatever. So people that are in this window, they're thinking about it, and you should be proactive. Next thing, if you've got some self-employed or some business owners, I mentioned it earlier, but an ICRA or QSERA, is really something that they should be looking at. This combines kind of the individual market and the Affordable Care Act strategy, stuff like that. This is very, very, important. People that are, divorcees, widows or widowers. We have a really, really great partner that really strictly works with widows. It's a great firm. They've been a really, really good partner of us for over a year. We work with a lot of them. Unfortunately, in that situation, health insurance is an issue. It's a transition period, right? So, look for situations like that. Last, people with high income or variable income clients, right? Look for, put them on a list and look for ways that you can plan to execute a premium tax credit, strategy, or to just make sure that they don't do something that's going to make them lose eligibility for credits or put them over the limit, especially if we move into, a window, like we're anticipating for 2026. Great question, Brittany. I see it. I will answer it here in just a bit. So another thing you can do to use your CRM, you can put some event reminders in there. You can put some birthday cues, right? So we're going to talk about Medicare in the next session. I'm doing that one as well. I hope you come and join us. ACA dependents. You got kids, turning 26. Retirement plan withdrawals. Check the subsidy cliff. You got to do it. And then you got to make some notes here on, ACA and Medicare open enrollment. Super ultra important. Another thing, we love when financial advisors that work with us actually run a quarterly report, and they find clients that are in that 60 to 64, and they are proactive, reaching out to them, or maybe they send them an email, right? Christine kind of gave some information. Let's do a healthcare touch point. There's ways that you can send it out. Make sure that people are doing stuff because you don't want them to mess it up, right? Document things in notes, right? Hey, Judy is going to retire in July of 26. We'll need individual insurance. It's unfortunate, that we have a situation many times where many clients don't even know that premium tax credits exist. They don't even know that they can utilize it. They don't even know that the federal government helps people pay for insurance in the individual market. They just kind of wait until they're 63 and a half. They quit their job, they get COBRA, and they take COBRA for 18 months. And they spend $2,000 a month for COBRA, and they do that for an 18-month period. Crazy, right? That happens every single day. There are millions of people out there that are contemplating retirement that don't even know what they can do in the individual market. So we don't recommend for you to be, the expert, right? I encourage you to collaborate with specialists. If you have somebody that you work with already, great. If you don't, we'd love to have the ability to partner with you. I would tie health insurance to financial planning, right? This is massive. Show them how premium tax credits work. Show them how you can do things. Make sure that the choices that you make, are doing things that impact this. Nicole, great question. The short answer to this is no. Credits cannot be received or applied for retroactively. Definitely not for previous tax years. There are situations where you can have an estimated income, and you can be utilizing a specific tax credit for that plan year. And then if your income actually ends up being lower than what you anticipated, you will get more credit when you file your federal tax return. But if you have a situation where a client, had health insurance, they just bought their own health insurance in 2024, and they paid $2,000 a month or whatever they paid, and they had a $50,000 income and they would have gotten a tax credit, you can't go back and get them. You have to go through the federal marketplace or a state-based marketplace, you have to use an agent or a broker that's qualified to do it, and you have to apply for them. They're called advanced premium tax credits for a reason. So short answer is, you can't really do it retroactively. And you gotta be active in these seasons. Okay, so every fall when college football comes around, NFL, you think about Medicare, think about Affordable Care Act, in November, when the pumpkin spice lattes start flowing, so do the advanced premium tax credit as well, right? So just think about that, those are some things you can do to be successful. So Scott Stoffer says, hey, are you going to be sending out the slide deck? And the answer is 100%, Scott. Thanks for coming, even though you got here a few minutes behind. No worries, Scott. Thanks for being here. Question, Brittany Wagner says, so if we have younger client couples that are already retired but not Medicare eligible, if we plan to manage their income appropriately to be under the threshold for 2026, does their 2025 income have any impact on their eligibility? Great question, Brittany. I love this question. The answer is no. It doesn't have anything to do with previous year's income. Don't conflate that with IRMA and Medicare and previous years and impacting that. Advanced premium tax credits on the Affordable Care Act Marketplace only matters in the current year or the next tax year. Okay, so for instance, in November, when we're signing people up for 2026, we're going to be putting on the application their estimated income for 2026. Okay, 2026. So it doesn't have anything to do with 25. Remember a few minutes ago, if you caught me, I was talking about a situation where maybe people take big lump sums in this year. We've had situations where clients have taken $300,000 in a current tax year to plan an income reduction over 26, 27, and 28. Why would they do that? Well, because advanced premium tax credits could be worth more than the tax hit that they would receive by taking that lump sum distribution, right? They're massive. That one scenario, the case study I showed you, it had a $100,000 impact over a 4-year period. Okay. Really, really great question, Brittany. That's good. It doesn't have anything to do with previous years. And it doesn't have, it doesn't have anything to do with previous years, and it doesn't have anything to do with what you've done before or your net worth or assets or anything like that. It's literally modified adjusted gross income. So Josie, thank you. You're awesome. So Josie has some questions. The first one, are the rates we see on healthcare.gov per person or for the family? Great question. It depends on what you put in, right? If you put in everybody in the family, it's going to be for the family. If you put in just one person, it's going to be for one person. Healthcare.gov is tricky. It's hard to use. We've developed a tool over at Move Health that makes it very, very simple. You can put in on the Move Health platform, you can put in zip code, age, and modified adjusted gross income, and you can get an analysis within seconds. That's our advanced premium tax credit estimator tool. Super easy. Second question, how do pre-existing conditions affect rates for coverage? Great question. Guess what? They don't matter. And that's been that way for 10 years. The Affordable Care Act that was passed March 23rd, 2010, removed the insurance company's ability to utilize, to use pre-existing conditions to affect price. You can't. The price of health insurance is only based on your age, where you live, and what plan you're choosing. It has nothing to do with pre-existing condition. Their medical complexity, cancer, heart attack, stroke, prescriptions, all that stuff, none of that matters. Plans are guaranteed issue. Pre-existing conditions are covered immediately. They're all required to cover 10 essential health benefits like preventive care, doctors, specialists, mental health, pregnancy, maternity. They all have these rules. And so pre-existing conditions are not a problem in any way, shape, or form for Affordable Care Act compliant plans. This is the same in federal states and state-based marketplaces. No impact. Next one. Is a high deductible health plan always the best choice for our clients because of access to health savings account? Great question. It's not always the best choice. Depending upon how much they're leveraging from an advanced premium tax credit, we end up seeing a lot of clients actually enroll in silver level plans. Okay, so it's not always boom, let's go with an HSA plan. If they like that and that's something that they're kind of used to, or they're needing the ability to to make contributions, they want the ability to make contributions, we might utilize an HSA qualified plan. But I would tell you it's a definite minority percentage of clients that have HSA qualified plans. Typically, when people are leveraging tax credits, We have multi-millionaire clients that are in silver level health plans with 500 deductibles that pay $0 a month for health insurance because of effective income planning with financial advisors. Again, multi-millionaire clients that manage their modified adjusted gross income down in the $40,000, $50,000 range, and they pay $0 a month for health insurance. And they've been doing it for 10 years. Okay. This is not a new thing. This is not a new thing. It's been going on for 10 years. So great question. Next one. Do you know when the 2026 plan data will be released? Actually, I do. Generally, we get a little bit of a preview on our tool a couple of days before November 1st, but generally it's available November 1st. You can comb through. Some states have public rate filings, and you can go through and kind of comb through and do a bunch of work on that. We do that. That's our analysis. We know what's coming. That's how I know that most insurance companies have filed for pretty large rate increases next year. But there's not a tool that allows you to kind of plug it in and see 26. Okay. The best thing you can do is do your work off of the modified adjusted gross income. You know, don't really worry about gold, silver, bronze and who's going to be there and what the rates are. They really don't matter. If you can get the modified adjusted gross income down, they're going to pay no more than 8.5% of their modified adjusted gross income. That's the affordability factor. That's how it works. If I see somebody at the grocery store, I can tell them exactly what is, exactly what their healthcare costs are going to be. So that's a really, really good question. 2026 rates will be out in a little bit. They're not out now. They are filed. They're done. They have to do it. And insurance companies have had to file those rates with the potential expectation that we may lose enhanced premium tax credits. And so they're taking that into consideration. Again, most people are going to be under that threshold, but some people are not. And I think those people typically work with financial advisors. So you may have some clients in this bucket. Don't let them run into this, and don't let this be a problem for them without you, hitting it head on. Great question. Last one, Josie's put in the chat here. If an advisor is partnered with Move Health, when should they start initiating client engagements for ACA coverage review? So great question. We can't really do anything until November 1st. Okay. So most of our existing clients, we are proactively working, with existing clients as well, but you can't really do anything until November the 1st. So I encourage you, if you're actively working with Move Health today and you're partnering with us, encourage your clients to make a meeting after November the 1st. But that doesn't stop you from doing income management now. You can go ahead and start doing some income management now, especially if you have clients that are, if they're already in the individual marketplace, they can do some income management now. And then if they're thinking of retiring and moving into the space, you definitely need to be doing income management now. Maybe they're working and, maybe they're a, CEO, they make $250,000 a year and they're going to retire and they're going to have some, other, some stock and some other cash out. They might end up with $1 million, $1.5 million in income this year. That's a perfect time because they're already in that top tax bracket. That's a perfect time for you to convert some other dollars, throw another X amount of dollars in here, and then get their income down for 26, 27, 28, or however long they need so that you can leverage and do this. You'll be a hero. If you know how to do it and you know how to leverage it and you do it right, you'll be a hero. Brittany, great question. Is the 8.5% of Magi the total amount a client would pay, or is it 8.5% per person? Great question. 8.5% is the household affordability factor for a silver level benchmark plan. Okay. A lot of words I just said there, but it's 8.5% for the household. Whatever their tax, if they're a husband and wife, they have to file taxes together. And it's 8.5% is the limit for the household. It's not per person. It's a really, really great question. I love being with financial advisors. I love being on calls with you all. I love that you made a decision to join our open enrollment summit. I love what Josie Living Good, our director of marketing, has done. There's a number of you that are on this call with incredible questions. And maybe you're coming and you're learning stuff for the first time, or maybe you're an existing Move Health partner and you're just coming to support us and kind of learn some things. I hope that you have some really, really good takeaways from this particular session. The Affordable Care Act is a crazy thing. It's complex. There's a lot to it. Don't try to do it alone. Don't let your client go out and risk making some massive mistakes that could cost them a lot of money. So thank you for being here. Thank you for attending. It's been an amazing session. This is session number 2. We have another session coming up. After I get a breather, I don't know, I may go eat, a sandwich or some sort of snack. We've got a little bit of time here between now and 1:15 Central Time. I'm on Central Time. I don't know where you all are, but we've got a little bit of time before our third session comes. And it's going to be all about Medicare. So what financial advisors need to know about Medicare? We're going to talk about Medicare supplements. We're going to talk about Medicare Advantage plans, drug plans. We're going to talk about how all of that works and what you can do as a financial advisor to help make this process in this time of year super successful and super effective for clients. So this slides will go out. Thank you, Jennifer. You're so kind. Thanks for being here. These slides will go out. The recording will be available. Thank you for asking your questions. Take a break. Come back and join us at 1:15 Central, 2:15 Eastern. We look forward to seeing you all in about a half hour. Thank you so much, and we'll see you in a bit.